Today I am going to talk about what is slip disc, what are the causes of slip disc and how to treat it. I am Dr. Pallav Bhatia. I am consultant spine surgeon at Lokmanya group of hospitals, Pune. So slip disc is a very common problem that we see in our day-to-day routine OPD, and mostly 80% of patients who come to us, they are suffering from this problem. So let's know what is slip disc. So before telling you more about slip disc, I will to tell you something about what we call as anatomy of spine. So how does our spine looks like? So today I have brought to you with me this short, we can say this model. So we can see these, what I have seen, these are our vertebra, or we call as a bone in our spine. And between the two vertebra, this soft structure what we are seeing this is known as disc. And in between this, what we can see, this is our spinal column or the spinal cord. From the spinal cord, each nerve supplies different muscle of our body. So each nerve has different function. When there is any problem in the nerve, there is different muscle which is paralyzed or different muscle which is involved. So what is slip disc? So when this disc comes out because of any reason, this is known as slip disc. So why does this happen? So to understand it, we have to take different type of people into consideration. So if we see our agriculture or our farmers, then most of their work is bending forwards or lifting weights. So because of it, it puts lot of pressure in their neck and back disc, and that's why it comes out and causes slip disc. But if we see in our urban population or urban areas, the most of the people, they are having work which is sitting at one place or which is a sedentary work. So why do they have slip disc? So the main reason is because of their sedentary lifestyle. The disc gets degenerated faster. So what used to happen at the age of 50, 60, it's happening at the age of 20 or 30s. And because of this degeneration, our disc becomes very soft. And that's why it prolapses further. So we are seeing slip disc now, which we used to see at the age of 50, 60, we are seeing at a very younger age. And the cause of it is because of our sedentary lifestyle, less exercises, and also because of obesity, because of sedentary life, because we are sitting in one place. So that's why we are growing more and more obese, and because of it, our disc gets more pressure, because if we are obese, if we are more heavyweight, it will put more pressure on our spine and our disc will come prolapse out. Again, one of the main common reasons is we are very fond of lifting weights, and when we lift weights, if our posture of the spine is not correct, then it puts more pressure on the disc and it has a tendency to prolapse out. Slip disc is also very common in ladies who are working at home, because when they are working, then if the posture is not good, if they are more involved into forward bending and weightlifting, then they also carry a chance to get slip disc problem. So after knowing all these reasons, we also should know that what are the symptoms of slip disc. Slip disc will begin with a normal back pain. So you will have just a back pain. It is not necessary that slip disc will always cause pain in your leg. So it will always start with a normal back pain, and don't undermine this, because a lot of patients, they say that I have a back pain. Mostly it is muscular, but no. You should see a doctor, or you should evaluate yourself to know whether this is a normal pain, normal muscle pain, or it is a pain because of a slip disc. And you should take all the precautions. You should do all the exercises which your doctor suggests you, so that it doesn't aggravate further and it doesn't carry in your legs. So it starts with a normal back pain, but then it carries to your leg, it travels to your leg. It can cause numbness in your leg, it can cause paralysis or weakness in your leg. You might have difficulty in walking. You can also get problems in your urine and stool, which is not a very common thing, but it can also happen in slip disc problems. So you should take care of yourself. Now if we talk about treatment, most people have that misunderstanding that if we have slip disc, then it will mostly require a surgery. So a lot of patients do not visit a doctor also because of this fear. But I want to tell you that almost 80 to 90% of patients of slip disc, they do not require surgery. So that is a sigh of relief, I know, but yes, that is true. Because most of you, if you have a slip disc problem and if you visit a doctor in your early stages, then you can save it from going to surgery. There are a lot of good amount of physiotherapy, exercises, plus some medications, because of which you can avoid surgery in your early stages and in a minimal stage of slip disc. So do visit your doctor, do go to your practitioner or a spine surgeon who can save you from going to surgery in early stages of slip disc. Now suppose if your slip disc problem is not getting solved because of it, then we have some procedure which we known as transforaminal root block, or we call as simply as a spine injection, which if given at a proper time and in a proper way can avoid surgery in some cases. So in this, what we do is we see in a machine and we give you a steroid injection in that portion of the spine or in that nerve which is getting affected because of the slip disc. Now there are some patients who, because of their slip disc problem, they get weakness in their legs, or as I told you, they get urine and stool problems, or they get numbness, they cannot walk for some few distance. In such type of patients, sometimes surgery is required. Now surgery is not like a open type of spine surgery which used to be done earlier. So now we solve slip disc problems with endoscopic spine surgery, which is done very regularly in our hospital, and because of which we can avoid the complications of the spine surgery, or what we can say, we can avoid the major bed rest which used to happen before this endoscopic spine surgery was developed. So we can avoid all the disadvantages of open spine surgery, and with endoscopic spine surgery, I am glad to tell you that you can walk on the same day or the next day of the surgery, and your post-operative pain is also very less. You can return to your activities faster, and it is a very great boon for the spine surgery patients. So as I told you, as we have discussed in this topic, the slip disc, what is slip disc and how does it occur, what are the treatment options available for it. So if you have any problems or if you have any queries, you can WhatsApp, you can comment in the comment box, and we will definitely reply to you with your problems. Thank you so much.